Hello and welcome back to the Canine Arthritis Management Owner Workshop. Module 4 is Visual Diagnosis enough? And what is the vet's role, part 1. So we've already done what is arthritis and what is all the fuss. We've talked about how to prevent it and what we should learn for the future. We've talked about how to identify the signs of arthritis as well as the caregiver placebo effect. Now we're going to talk about how do we actually diagnose and what is the vet's role in managing this disease. So the importance of a diagnosis. The main clinical sign that owners see is that their dog slows down or starts to demonstrate signs of getting old. However, many diseases can show these clinical signs. It is not only arthritis that can cause behavioural changes. Without a correct diagnosis, the real disease is not treated and time can be wasted. You might be giving your dog inappropriate medication and therefore experiencing unnecessary side effect risks. You might even see no response to treatment, and the dog will continue to show signs of ill health, causing you to worry and also waste money and potentially lose faith in the vet treating the case. If we don't get a diagnosis, we can't predict the progression of the disease. And in honesty, your dog may be suffering. Getting an accurate diagnosis is imperative. Osteoarthritis can look like many conditions, and many conditions can look like osteoarthritis. In my time as a vet, I have seen many cases of misdiagnosis. Obtaining a diagnosis involves a thorough clinical examination by your vet, a neurological examination, an orthopedic examination, maybe some diagnostic imaging, and a blood test or urine test. The clinical examination, neurological and orthopedic, can all be performed within the consult room. The urine test can be brought in from home. The blood test can also be taken during that consultation period. Diagnostic imaging generally involves a short stay and likely a sedation or an anaesthetic. This slide demonstrates the presentations of shoulder discomfort. On the left, you can see arthritic change and biceps tenosynovitis. The middle radiograph shows a sarcoma. So an osseous sarcoma, which is a soft tissue tumour surrounding the shoulder. And the radiograph on the right is intervertebral disc disease. All of them would present with pain. All of them are treated differently. So as suggested, from my own experiences, I have often seen misdiagnosis and comorbidity. I've experienced dogs that have been diagnosed arthritic who seem to be in a very progressive phase of the disease. But when a blood test has been performed, we found out that they were hypothyroid, and getting them on the right medication saw a sudden lease of life. I've also seen cases that are assumed osteoarthritis discomfort when actually they've been cancer, liver disease, splenic tumours, kidney disease. We often see changes in gait and weakness in limbs assumed to be arthritic change within the joint, when actually it's a nerve disease. I've seen cases where it's believed it's a progressed arthritic joint, when actually it's unstable, such as in cruciate disease of the knee. I've also seen cases that have been on new drugs that are actually causing side effects, making the dog feel drowsy, slow, unenthused, and the dog has been assumed to be progressing, when actually it's a side effect of the drug that they are on. So just to remind you, it's a case of teamwork to manage these cases. And another silly analogy, this bike, the vet is the frame, The nurses are the wheels, but you as the owner are the tyres to make sure that we have a comfortable ride. All of us work together to make sure that we manage these cases appropriately. So, how do we achieve a diagnosis of osteoarthritis, having realised it's really important? First of all, you as an owner will be recognising the signs of change in your dog. Behavioural change, postural change, physical appearance changes, capability and gait changes. We encourage you to go to see your vet and discuss the changes that you've seen in their mobility, their activity, their appearance and their behaviours. The vet then will perform an examination to rule out comorbidity and localise the source of pain. And then they will encourage you to consider diagnostic imaging, as well as checking the systemic function of your dog with blood test and urine test. This is how we get a diagnosis. Now on to the vet's role in managing arthritis. And this diagram hopefully illustrates how important the vet and the owner are in managing this disease. The vet's role are the yellow triangles and the owner's role are the green circles. You as an owner play a massive part in the appropriate management of this disease. Let's begin with looking at what your vet does to help. Vets are the only people allowed to diagnose, allowed to legally perform procedures, and legally prescribe. They are an absolute essential part of management of arthritis. Let's deal with the first part of their role, which is generally providing pain relief. We will talk about non-steroidal anti-inflammatory drugs. At this moment in time, I'm just going to take a little tangent. Communication between the vet and the owner is absolutely foundational in managing this disease appropriately. Time must be given from both parties, coming in with an open mind to listen to suggestions is really important. Sometimes we have owners that come in that do not want to hear what the vet is saying, and therefore we start on a bad footing. Please consider how you approach the consultation with your vet. Please listen to how they are trying to help you. So back to this paper regarding non-steroidal anti-inflammatory drugs that Zoe Belshaw produced. Non-steroidals are a foundational treatment when managing osteoarthritis. However, they often seem to feature with bad press. Where is this fear coming from? Let's try and get to the bottom of it. So in Zoe Belshaw's paper, where she was talking to vets, vet nurses and owners, she had these findings. When discussing with owners their expectations, their service provision, it turned out that many owners felt that they weren't actually given enough time to explain the disease and what interventions were being used, the benefits of the intervention, the potential side effects, and how to use more appropriately. It wasn't the actual choice of intervention, it was all the communication surrounding it. Owners find it very hard to identify the signs of pain in their dog. So this may have led to them using the intervention inappropriately. They may perceive the dog has got better and stop it prematurely, or they may have perceived that the dog was worsening, so they doubled the dose inappropriately. The current consultation system is actually making it very difficult for vets to offer you this service provision. With the shorter consultation times, the busy practices, the hubbub of what happens every day in a practice, means that this communication can suffer. We've also found a wealth of easy access, incorrect information, especially online, as affecting owners' judgment and choices. There's also a massive lack of public knowledge which therefore leads to fear regarding the side effects. And this causes poor compliance, inappropriate use, and therefore causes more side effects. So hopefully by the end of this module, you're going to feel more confident about where non-steroidals fit in a treatment plan. But first, we're going to just talk a little bit about online information. Again, this is another addition that you probably didn't expect to hear. So, we've got a terminal disease. It's leaving you as an owner vulnerable. You're already finding it hard to interpret, monitor, be objective, take your emotions out of decision making. You're confused, desperately looking for solutions, worried that you're not doing your best. So what do? What do we all do? We hop onto the internet and generally have the habit of making the situation worse. So let's look more at Zoe Belshaw's research into owner behaviour online. We've found that 98% of small animal vets say that owners consult Dr. Google, with 80% seeing pets that are brought in that vet's opinion, too late in the disease progression. But the resources aren't just in Dr. Google. If the owner can't find what they need to know readily, they will jump to Dr. Facebook. Now, what I need to reiterate from Zoe's work is something that I had not considered to be as powerful as it actually is. When online, if you are not paying for something, you are the product. This means that you are directed, trafficked into situations where you will become potential income for someone else. The algorithms online drive you to a destination where you are likely to commit, join, or purchase. Within Dr. Facebook, there are now what are called bubbles. And these are crowdsourcing information sources, generally biased, often run by non-professionals with their own biases. So you are being channeled by algorithms to find what you would like to find. And that quite often isn't a balanced way to look for further information. Because the majority of people go online with preconceptions and beliefs, and they click on what they already agree with. This is called cognitive bias. And we do it because it's comfortable. Me, as a vet, I will tend to click on things that resonate with the training that I have had as a vet. You, as a dog owner who has heard from a few dog walkers in the park that something has been effective, will automatically look for sites that suggest the beneficial effect. We can't help this. We're human. We find it difficult to look for information that is balanced and neutral. So going back to the non-steroidal question, why are we in so much fear? What has created the situation? When you actually look at non-steroidal use, it's one of the most useful medications and one of the biggest jumps in veterinary medicine, being able to provide reliable pain relief. We use anti-inflammatories, the non-steroidal group, day in, day out. So where has this fear come from? Cam decided to approach a veterinary-based forum. There were over 600 veterinarians from around the world on said forum, and we posed a simple question. Would you prescribe anti-inflammatories to your own beloved dog? Of the 200 plus vets that actually replied, 100% would put their own dogs on NSAIDs. Now this really does demonstrate that the people that are working on the front line, day in, day out, with all manner of cases, from an abscess to dental disease, from a lameness to chronic arthritis, from post-surgery to a road traffic accident. They know that non-steroidals offer reliable pain control and would always consider using them because the benefits they see outweigh the risks. So now I want to actually talk about pain in greater detail, and then you'll understand how clever non-steroidals can be. So pain is a multi-dimensional phenomenon. There is a sensory component, behavioural, physiological, cognitive, affective. Let me explain this. So the sensory component of pain is merely a signal. We have something that happens to our body that generates a neurological stimulus that is then transmitted to the brain and interpreted. It's just a sensory event, talking about the intensity, quality, and location of where that signal came from. Then our cognition interprets this sensory signal. What does that information mean for me? This is where we begin to interpret it as pain. But there is also an affective component. Previous experiences, creating a negative emotion about the pain. We all know this. A typical example would be a bad experience at the dentist affecting any further visit, with us fearing it will be painful again. And if we do succumb to some pain, it will be magnified because of our previous event and therefore expectation. What's quite exciting, though, about this affective component means that we can positively create an affective state that potentially can override pain perception. A good way to demonstrate this, if you're having a bad day and the car has broken down and you've broken a mug and you've just had a bill come in and you stub your toe, it feels more catastrophic than a good day when you've just had a check through the post, the sun is shining and everything is rosy. Stubbing your toe in a positive state of mind is less severe than when you're already in a negative state of mind. Another component of the pain experience is the motor component. And this is our actual ability to move away, change our posture, create a coping strategy, our behavioural change. So as you can see, pain is actually very complicated. More regarding how complicated pain is. The technical term of a pain physiological experience is nociception. It starts off with stimulation, and let's use stubbing the toe as an example. Stubbing of the toe is the stimulation. This causes a release of inflammatory mediators due to tissue damage. That inflammatory mediators are changed by transduction into an electrical stimulus that travels up nerves to the spinal cord. This is transmission. So the electrical stimulus traveling along nerves is transmission. Once they reach the dorsal horn, which is part of the spinal column, those signals can be modulated. And that means that they can either be dampened or they can be magnified. This electrical signal then passes up the spinal cord to the brain, where we perceive that electrical stimulation as pain. It's extremely complicated. So let's return to the role of the non-steroidal anti-inflammatory drug. It actually has the ability to affect multiple parts of this pathway. At the periphery, where there is the modulation, at the spinal cord, where we also have modulation, and at the upper brain centers. So this anti-inflammatory isn't just working to reduce the inflammatory soup surrounding the area of inflammation. It has multiple roles in this extremely complicated pathway. So non-steroidals actually work in a variety of locations, which is really important. Because when you have tissue damage, such as an arthritic knee, an arthritic hip, an arthritic toe, you have something occur called peripheral sensitization, where a mildly noxious stimulus becomes enhanced into a severely noxious signal because of the inflammatory mediator soup that surrounds those nerve endings. This is called peripheral sensitization, and anti-inflammatories work there very well. But we also have something called central sensitization, where the prolonged high-intensity noxious stimulus coming from the periphery, such as the pain and inflammation of arthritis, results in central wind-up and a perception of an enhanced signal. This means that we perceive more pain than is actually there. It's extremely complicated, but we know that non-steroidals have the ability to influence both areas. So just to reiterate, non-steroidals are used a lot in practice, and the reason we use it is because we need to use a product that we know will work. Elective procedures in a vet practice, such as dentals, spays, castrates, surgeries, we know they will cause pain. And what we want to do is preempt that pain and try and minimize it. We routinely use non-steroidals because we know that they are reliable at reducing pain. You would not like to go to a vet who would say to you, "We could try it, it might work," as you're about to have a major operation performed on your dog. Non-steroidals are used on a daily basis, hundreds of times in thousands of practices, successfully. So what does cause these side effects that hit the press? Well, it's actually because of the function, the way that these anti-inflammatories work. What they aim to do is to block an enzymatic pathway, which is producing prostaglandins. Now, prostaglandins can sit in two camps. We have our good prostaglandins, which help with our gastrointestinal recovery and integrity, our kidney function, our ability to clot. But they also have prostaglandins that are involved with inflammation, pain, and fever. We try to use anti-inflammatories that have been created to be more specific to enzymes that seem to produce more inflammatory prostaglandins. But we know that the picture is not that clear. Over time, we are developing more anti-inflammatories that are more specific to minimize the effect on the good prostaglandins. However, it isn't that simple, and sometimes we do see side effects. The main side effects that we tend to see are related to gut. So we see a bout of diarrhea, a loose stool, a bit of nausea, some vomiting. And on severe occasions, we might see bloody diarrhea or bloody vomit. However, compared to the frequency of use, this is actually very rare. Just to highlight about how these drugs are produced, there is a huge amount of trial time. And what they do is they start off with pre and clinical trials where they have a select number of patients and they perform a trial over a shorter duration of time. Once they have knowledge about the efficacy and the safety, what dose to use and the frequency to give it, the drug will then go into circulation. And a greater amount of detail is collected with a larger trial number, different types of patients, i.e. breeds, ages, ranges, animals with different conditions and potential comorbidities. And these trials go on for longer, so we can collect more data. Because some side effects regarding medications, pharmaceuticals, are not known for a long time. Now, to just put this into perspective, the first anti-inflammatory drug was aspirin, and that came into production in 1893. We have been using these anti-inflammatory drugs, this family, for a very long time, which means we know a lot about its mode of action and the potential for side effects. So as said, the side effect most commonly seen is self-limiting gut upset. To you and me, that is a little bit of diarrhea, a bit of vomiting. There's a very low figures of side effects compared to the frequency of use. We do sometimes see severe side effects, but they are actually very, very rare. And it is commonly associated with comorbidity, that the animal actually has another coexisting condition, or the drugs were not used appropriately, or they were used in combination with other drugs. What this means is that when your vet is suggesting to you a urine test or a blood sample or a reassessment, is they're checking for many things, including if your dog has got any other conditions that could affect the use of the anti-inflammatory that they have prescribed you. As with any drug, all non-steroidals have the potential for adverse effects, and this should be considered. Unfortunately, these potential side effects can put many people off wanting to use these drugs, meaning that they are left instead without any pain control. As vets, we frequently hear objection to using non-steroidals, even in the short term, often due to horror stories seen online. I hope that our little tangent about online information and the more detail we've gone into of how anti-inflammatories work will give you more confidence to accept your vet's advice. Another section. Non-steroidals are perhaps one of the drug classes we most frequently have side effects reported for, but that is only because they are in use in such high numbers. Almost every surgical patient seen in any vets in the practice in the UK will be given a non-steroidal anti-inflammatory drug. That's thousands every single day. Almost every dog that comes in limping, coughing or sneezing will receive a non-steroidal. The most severe side effects of non-steroidals, such as gastrointestinal ulceration, raised liver enzymes or kidney disease, are classed as very rare, i.e. 1 dog in 10,000 will be affected. What this means is we shouldn't be avoiding using them, because we can't justify leaving our pets in pain when we are worried about low-risk side effects. This is a contribution from one of our followers. This is a dog prior to using an anti-inflammatory. This is the same dog after 24 hours. They can be extremely effective in controlling pain, and they have a lot of trials and tests to ensure that they are effective over caregiver placebo, as also mentioned. This drug has been a game changer for this dog's quality of life. What is exciting are there are many new drugs coming to the commercial marketplace. A new group of drugs out called the EP4 receptor antagonists are more specific, blocking action of the negative prostaglandins. They work much lower in this inflammatory cascade, and we believe they are likely to cause less side effects. They do not inhibit the prostaglandins that are positive for the body, the ones that are involved in gut recovery, kidney function, and clotting abilities. We anticipate that we will not see the same side effects. However, only time will tell. This is from Andrew Tarr, who runs an independent organisation called Veterinary Prescriber. An important point to make is that non-steroidals have been relatively well studied in dogs with osteoarthritis. There is much more evidence on non-steroidals than for any other drug treatment. We know that they relieve pain and reduce inflammation, and this is undisputed. But for some reason, a dog may respond better to one non-steroidal than another, and this is seen also in humans. So if one has no effect, it is certainly worth trying another. What we do need to know as well is no one non-steroidal has been shown to be more superior and effective than another. So this means that the choice of drug that your vet prescribes isn't because it is superior to others. And it also means that if you do not see beneficial effect, then it is worth changing and trialing a different. So module 4, quite a heavy module, the summary. We need to get an accurate diagnosis. It's essential to avoid inappropriate interventions, as many diseases can look like arthritis. An accurate diagnosis requires a thorough veterinary clinical assessment and working with the owner's observations and history. They may require diagnostic imaging to be sure that the believed disease is actually present. Non-steroidal anti-inflammatory drugs are a staple intervention when managing arthritis and have a lot of respected research evidence to support their use. Non-steroidals are used extensively in medicine, and the side effects are actually low considering the scale of use. Non-steroidals are more likely to cause their well-publicised side effects if they are used inappropriately or if the dog has a comorbidity.